The topic for us now is what the Supreme Court decision on Obamacare will mean to you. Here to whet your appetite a bit with a longer presentation later at FreedomFest, please join me in welcoming John Goodman. John.
Ladies and gentlemen, our long-term deficit problem is a health care problem. If you are not focused on responsible reform of the health care system, then you are not seriously interested in reforming the federal deficit. Obamacare is not the answer to this problem. It is the most radical piece of legislation passed by the U.S. Congress. It will affect everyone in this room, everyone with private insurance, everyone on Medicare, everyone on Medicaid. The federal government right now is going to tell you what kind of insurance you have to have, where you get it, what you're going to pay for it. People in the White House are deciding every detail of your health plan, what kind of contraceptives you're going to have coverage for, how often you can have a mammogram or a pap smear or a prostate cancer test. They plan to tell your doctor how to practice medicine, and if he doesn't comply, there will be financial penalties. There are no death panels in this bill, but there are practice guidelines, and they will give cover to insurance companies to deny you care. Here is the good news about Obamacare. It is such a mess that it is likely to collapse of its own accord. You will be required to buy a health plan whose cost is going to grow at twice the rate of growth of your income. So eventually you'll reach a point where you have nothing to eat, nothing to wear, no place to live, but you'll have lots and lots of health care. It has a bizarre system of subsidies. People in this hotel who are making $10, $15 an hour will be required to have family coverage that costs half as much as they earn in wages. And yet the bill gives them no additional help to carry this burden. But if these employees manage to get over in a newly created health insurance exchange, the federal government will pay 98% of the premium. How many businesses will have to restructure? How many workers will have to lose their jobs before people realize that this is not a solution to our health care problems? Insurance companies will have incentives to underprovide to the sick and deny them care. And the federal government will give them cover in order to do this. When the employers leave the market and when the insurance brokers leave the market, you are not going to have a protector and a defender to help you deal with the remaining bureaucracy. 32 million people will be newly insured, and all of you will have to have more generous coverage than you currently have or want. And what this means is a huge increase in the demand for care, but there is in this legislation no change in supply. What that means is we're going to have a major rationing problem. People are going to try to see doctors more often and more frequently. They're going to try to get the care that they have been promised, and they're going to find that it's not there. In this kind of world, you're going to want to have your own concierge doctor, and it will not pay you to be in a plan that pays below market. If you are a senior or you are disabled and on Medicare, if you are a poor person on Medicaid, if you're on one of the newly subsidized plans, if it works the way it's worked in Massachusetts, you're going to be in a plan that pays substantially below what Blue Cross and private insurers pay. And if you're in one of these plans, you will be the last patient the doctor wants to see. Strangely, our most vulnerable populations are the ones that will be most at risk. If you are a senior on Medicare, you've been lied to. You've been told that you will get new benefits and there will be no costs. In fact, over half the cost of Obamacare legislation is paid for by gutting Medicare. And the chief actuary of Medicare has been very straightforward about what this will mean. Before this decade is out, in just 8 years, 1 out of 7 hospitals will leave the Medicare system entirely. Seniors will have increasing difficulty seeing a doctor with each passing year. Within just a few years, Medicare will pay for seniors will pay less than Medicaid for poor people, and that difference will continue to widen through time. So what we have here is a cutting of benefits for seniors that most people in Washington believe will never be sustained because this is a health care bill that was never really paid for. Now, my new book, Priceless, goes into detail on how we can reform the health care system in a rational way. I'm going to be at Laissez-Faire Books with a book signing tomorrow at 3:20, and then at 4 o'clock I will have a breakout session and we'll discuss all of this in more detail. I hope to see all of you there.
Wow, John, thank you so much. Okay.